Hi again, welcome back to the Health Tip this week. So we're going to continue on our series on cholesterol, and this week I'm going to be talking about the values that you're getting. So as I mentioned before, the total cholesterol number, so many people are getting put on statin drugs just because they have quote-unquote high cholesterol, which really doesn't mean that much in the big picture of things. That number is kind of irrelevant, and I'll kind of explain why that is a little bit. But so just as you know, some of the horrible side effects of statin drugs, just like fatigue is a really big one because it actually saps energy from your cells. It makes all your muscles fatigue and sore, but then it can also fatigue your heart, and then eventually even cause heart problems in that case too, which is kind of strange. But there's been a lot of other things, and I kind of mentioned it in one of the first videos talking about this, just as when you artificially lower cholesterol, you're causing a lot of problems. So statins have been shown to help people who have already had a heart attack, but if you haven't had one yet, it's really not a good idea. And obviously I can't give you advice to not take it or anything. It's all stuff you'd have to talk with your doctor about, getting off it and all that kind of thing. But I'm just going to give you an idea of some other things to ask for to really get an idea. If you actually are concerned about your heart attack risk, there's other things you should be getting measured, not just your total cholesterol. Because as I mentioned before, about half the people who have a heart attack have normal cholesterol levels, so that really doesn't make sense. So there's sort of like a spectrum of people. There's people that have high cholesterol, people that have low cholesterol, and somewhere in the middle is where they should be. But the people that have low cholesterol, some of them can have heart attack risk, and the people that have high cholesterol can have heart attack risk. But in the middle, those people, there can be highs and lows on both ends. So I'm going to try to explain all of that a little bit. So total cholesterol is kind of measuring, you've heard about the particles, low density lipoprotein, high density lipoprotein, there's some other ones called VLDLs, etc. I'm going to try to keep it simple just talking about these ones. But the important thing I want you to get in all this topic is the particles that are carrying the cholesterol. That's one of the key things I want you to get as something important to measure. So why is that? So like I said, cholesterol is waxy and it doesn't dissolve in your blood, so it needs to be carried on something. So it's actually carried on a particle. So this particle, just think of it like a protein. So proteins are a bunch of amino acids all stuck together and they're all wound up, so it's like a boat. So we're going to call that a car. So I'm going to put some cholesterol, just think of it like a soap bubble. So I'm going to throw 3 soap bubbles on that car. This is all just examples. So that car is going to carry around those soap bubbles in our blood to kind of carry the cholesterol to where it needs to go. So if there's only 3 cholesterol molecules on that particle, and I look at this whole thing, it's almost all this really heavy, dense protein. The cholesterol, think of these like little soap bubbles. So this whole thing in general is actually going to be pretty dense. So this would be called a high density lipoprotein because it's actually not carrying too many cholesterol molecules on it. And these things actually carry like triglycerides and other things too, but I'm just talking about the cholesterol for this example. So let's say I added 50,000 cholesterol molecules to that and it became a huge amount of cholesterol, almost all cholesterol soap bubbles, and just a little bit of that protein. If I looked at that whole big molecule there, that's almost all this fluffy like cholesterol stuff. That would be called a low density lipoprotein because it's not very dense, because it's almost all soap bubbles and very little protein. So this is what they consider the bad cholesterol, but it's really not bad, and there's no such, because the cholesterol molecules in here are all exactly the same, so there isn't a good or bad cholesterol molecule, there's just different amounts being carried on the particles, and what happens to the particles is important too. Let's say we have this car again. So let's say we're talking about a clot happening in the arteries, like in the capillaries and arteries around your heart. So we have a clot, meaning that there's a whole pile of cholesterol jammed in there. So pretend this is a car. So I'm going to make this like here's a vehicle here like this. It's a Volkswagen car. So that car is carrying cholesterol inside it. So this is going to have 2 cholesterol molecules inside it, let's say. If there's a traffic jam, okay, we have a big jam at the 401 there, the DVP and the 401 here in Toronto. Loads and loads of cars are building up, causing a traffic jam. So is it these cholesterol molecules that are causing the traffic jam, or is it the cars? It's actually the cars. So it's the particles that are causing the jam up, not the cholesterol in the cars. So this particle here, that's what's really important. So what happens is, when we start to have inflammation and a lot of different problems inside our body, the body actually starts to make a lot more of these particles actually. So there's more and more of these particles getting into the blood. So there actually are often low density lipoprotein particles, these particles, but they're actually becoming what we call oxidized due to inflammatory states. And those particles actually start to poke holes inside the walls of the capillaries. They actually start to break through. And when they break through on the opposite side, it starts to get inflamed in here, and then the body starts to actually bring cholesterol to heal clots, so it's actually pulling in more particles. It's trying to get more cholesterol here to heal these inflammatory wounds on the walls of the lining of the blood vessels. So that keeps getting bigger and bigger, and then pretty soon we have a clot, and then there's no more blood flow, and then all of a sudden we have a heart attack. So that one of the more important things really in this whole thing is these particles. So the particle number is actually more important than the total cholesterol, because they can be carrying more or less amounts, but how many of these particles are floating around. So I mentioned in the other video, if you're missing a lot of sulfur, the heart really wants sulfur as far as its electrical activity, and so it actually starts calling for more of these particles to be coming in, and so more particles are coming, trying to bring more cholesterol to the heart, hoping that there's going to be sulfur there, but when there isn't, it starts to cause these problems. So there's like a gradient, there's so many of these particles, they just start banging into the walls and start to cause these problems. So what are you actually want to be looking for, or what kind of test do you want to be reading? So some of the sources, basically the biggest damaging factor as far as heart attack or heart disease risk is actually inflammation. So inflammation is the key, and we're talking about global systemic inflammation in our blood system in general. Acute inflammation is good. If I hurt my arm or if I bang it or something like that, it's supposed to get inflamed. That's how my body heals. But we're talking about inappropriate globalized inflammation. That's one of the biggest things that causes problems. So how do you measure that? Well, one of the other things, so just to give you an idea here, if you want to measure this particle numbers, there's something called NMR. That stands for nuclear magnetic resonance. That's the test that will tell you how many particles you have floating around in the blood. Because there's a nuclear magnetic resonance actually measures different particle amounts, and it can see how many particles are in your blood. So that's the test you get to figure out your particle number, if you have too many of those or not. Things to test for your inflammation are C-reactive protein. That's really important. Another thing that there's something called homocysteine. So homocysteine, homocysteine is a byproduct of your cell's metabolism. So it's kind of like the waste product of your cells making energy. That gets into your cells, and when it gets inside the circulation, it can actually be irritating to the lining of the cells, and that can cause inflammation too. So that's something else you might want to get measured. So C-reactive protein and homocysteine, these are two big general markers for how much inflammation you have in your body. So you always want to check these when you're checking your cholesterol stuff as well. And there's different things that can cause inflammation in the body, but one of the most neglected and unknown ones is actually problems in your mouth and your oral cavity. There's a lot of people that have cavitations, or they've had root canals and those kind of things, and there's actually bacteria, we call them anaerobic bacteria, that are stuck in these little crypts or in these little places above the root canals or inside the teeth, or sometimes along the gum line, and they're festering there, and your body is actually always fighting those. And so it causes like a low-grade inflammation in your whole body. And mouth problems, actually, this kind of inflammation in the mouth has been linked to a lot of different things, because excess inflammation in the body in general has been linked to cancers, diabetes, heart attacks, and strokes, and those kind of things. So there's a lot of, just as a side note, a lot of women with breast cancers, when they've actually got their mouth cleaned out and figured out how to do properly, clean out root canals and teeths and fillings and all that stuff, when they've got that worked out, sometimes their breast cancers have actually gone away. Because they've done all the good things up to a certain point and it helped, but then when they finally got that figured out, then sometimes their breast cancer went away. So a lot of times that sort of inflammation from the oral cavity can be devastating for the whole body. And there's a reactive thing called cytokines, which can kind of come out of this whole inflammatory thing. So basically what happens is when there's an inflammatory response, your body sends a lot of white blood cells there to kind of mount the attack. But when they're sort of in circulation all the time, that's kind of happening everywhere, and you're getting a global inflammation. And that global inflammation can cause damage to artery lining, can cause damage to the walls. And when you have these particles smacking into the walls, causing little micro tears, then those micro tears, they want to get healed. So your body uses cholesterol to heal them, so it's going to cause a clot. And then because of the general inflammation in the cytokines, that's going to be more pro-inflammatory, so that's going to be more likely to happen. So that was the big picture. So hopefully, so there's other things too. When you get your cholesterol, they can kind of measure things like HDL to triglyceride ratios, and those are kind of important, and those are kind of helpful too. But the big thing I wanted you to get is that whole thing with the problem with the particles. And most people aren't aware of that, most doctors aren't even aware of that kind of thing, but that's an important thing. But then the other factors about inflammation, and the other big factor other than oral stuff causing inflammation, obviously having too much glucose or insulin spikes in your blood is a big cause of global inflammation in the body. And the other big thing would be toxins in the environment. Heavy metals, they bind, they attach to the cells, they can cause inflammation. So things like, aluminum and mercury and pesticides and glyphosate, all those kind of things, those are all big inflammatory things. And one other factor that's big on causing inflammation in the body is when you have a leaky gut, or the intestine should be nice and tight tube and only allow certain things in. But when you've had a lot of processed foods, or you've taken antibiotics, or you were born with a cesarean section as opposed to a vaginal birth, if you've had a lot of foods that have glyphosate in them, all of those things can actually cause the gut to be leaky, and then you have things getting into the blood that shouldn't be there, and your body attacks them like an invader, and that causes global inflammation as well. And all of this stuff can have a bad effect on your brain too. So is that enough for you? There's a lot there. I could go on for hours about all this, but that's kind of the general thing I wanted to get on, and that's kind of closes out our thing on cholesterol, I think, for this little series. And if I think of some other stuff later, I'll probably throw that in another video. So that's the key for this week. Hopefully this video was somewhat helpful. If you share it, please below, and spread it around, and let's get people on the track to health. So thank you very much.